Yo, what's up everybody? Professor V here, and this is what you missed in week 4 of the fall 2018 semester. Let's go. For my general psych students at WCJC, we did not get to discuss psychoactive drugs at all in class. A couple of these terms you have seen before since I've used them in class, such as agonist and antagonist. But before we review these terms, we need to understand what a psychoactive drug is. Psychoactive drugs are any kind of drug that causes an altered state of consciousness because it changes the mental processes in the brain. This includes marijuana and cocaine, but also caffeine, tobacco, and alcohol. Some get defensive about caffeine, tobacco, and alcohol being grouped as a drug, and even more so a psychoactive drug. However, they have an effect on the brain that changes typical behavior. Some psychoactive drugs are stronger than others, but it doesn't change the fact that they all alter consciousness, affecting the person psychologically and physically. Remember when we discussed what agonists and antagonists are back in chapter 2? An agonist is a substance or drug that increases a specific neurotransmitter effect, while an antagonist does the opposite. It decreases or blocks the effect of a neurotransmitter. Some drugs such as heroin act as opioid agonists, whereas naxolone is an antagonist of heroin. Endorphins typically activate opioid receptors in the brain. However, when someone does heroin, it enhances the effects of endorphins, which are our natural painkillers, but also, due to the advanced effect, puts us in an altered state of consciousness, being high. Whereas naloxone, when taken, blocks the opioid receptors and thus reverses a heroin overdose. Agonists such as heroin can alter the synthesis, storage, or release of neurotransmitters into the synaptic cleft during synaptic transmission, one of the processes we discussed in chapter 2 while in class. Normally, when the synaptic vesicles release neurotransmitters into the synaptic cleft to bind to the receptors on the postsynaptic neuron, the remaining neurotransmitters go through the process of reuptake, meaning they go back into the presynaptic neuron for recycling. However, an agonist may block this process occurring and thus causes a buildup of unnecessary amounts of a neurotransmitter in the synaptic cleft and prolongs the effect of the psychoactive drug. Antagonists are the opposites. They are shaped similarly but different enough from the natural occurring neurotransmitter that allows it to bind to the receptors of postsynaptic neurons, blocking the neurotransmitter from entering. Now, many of the psychoactive drugs can be abused and addictive. But what is the difference? Drug abuse refers to taking a drug that causes physical and or emotional harm to oneself as well as to others. Drug consumption is often compulsive and frequent. Addiction is a very broad term in which is used when a drug user feels as if they they feel compelled to use a specific drug or engage in almost any type of compulsive activity that isn't drug related, such as being a workaholic or gambling. To differentiate between abuse and addiction, researchers and practitioners look at the person's dependence. There is psychological dependence, which refers to the belief that the drug is needed to continue a feeling or emotional or psychological well-being, which is very powerful in continued drug use. The body may not need or crave the drug, and people may not experience the symptoms of physical withdrawal or tolerance, but they will continue to use the drug because they think they need it. In this case, it is the rewarding properties of using the drug that cause a dependency to develop. Physical dependence is after using the drug for some period of time, the body becomes unable to function normally without the drug, and the person is said to be dependent. One sign of physical dependence is the development of a drug tolerance. As the person continues to use the drug, larger and larger doses of the drug are needed to achieve the same initial effects of the drug. Another sign of physical dependence is that the user experiences symptoms of withdrawal when deprived of the drug. Depending on the drug, these symptoms can range from headaches, nausea, and irritability to severe pain, cramping, shaking, and dangerously elevated blood pressure. These physical sensations occur because the body is trying to adjust to the absence of the drug. Many users will take more of the drug to alleviate symptoms of withdrawal, which makes the entire situation worse. There are several categories of drugs which include depressants, also known as sedatives. The name doesn't refer to the drug causes depression, but that they decrease nervous system functioning. These include alcohol, barbiturates, anxiolytics or anti-anxiety medication, Xanax, roofies, ketamine, also called Special K. Depressants, again, cause nervous system activity to decrease, and thus there are some desired effects such as tension reduction, euphoria, disinhibition, drowsiness, and muscle relaxation. However, there are many more undesirable effects too, such as anxiety, nausea, disorientation, impaired reflexes, motor functioning, amnesia, loss of consciousness, shallow respiration, convulsions, coma, and even death. The more amount of a depressant is taken, the worse the undesirable effects. Stimulants act opposite of depressants and increase nervous system functioning and include cocaine, amphetamine, also called crystal meth or speed, methamphetamine, also known as MDMA, ecstasy, or Molly. Caffeine and nicotine as well are stimulants. Some of the desired effects are euphoria, high physical and mental energy, reduced appetite, perceptions of power, sociability, and increased alertness. However, there are also undesirable effects such as irritability, anxiety, inability to fall asleep, restlessness, paranoia, hallucinations, psychosis, elevated blood pressure and heart rate, stomach pain, vomiting, dizziness, cancer, heart disease, convulsions, and even death. Same as depressants, the higher the amount of a stimulant in the body, the worse the undesirable effects are. Opiates or opioid narcotics such as morphine, heroin, codeine, and oxycodone can cause euphoria, a rush of pleasure, pain relief, prevention of withdrawal, and sleep. However, may also cause nausea, vomiting, constipation, painful withdrawal, shallow respiration, convulsions, coma, and even death. Hallucinogens include lysergic acid dithylamide, also called LSD, mescaline, and I can't say that word, but mushrooms, and marijuana. The desirable are heightened anesthetic responses, euphoria, mild delusions, hallucinations, distorted perceptions, and sensations. Marijuana has the desirable effects of relaxation, mild euphoria, and nausea relief. However, some undesirable effects of hallucinogens are panic, nausea, longer and more extreme delusions, hallucinations, perceptual distortions, and psychosis. Marijuana may cause perceptual and sensory distortions, hallucinations, fatigue, increased appetite, lack of motivation, paranoia, and possibly psychosis. Last couple things from chapter 5 we didn't have enough time to cover is meditation and hypnosis. Meditation is a group of different techniques that are designed to focus your attention, block out distractions, and put a person into an altered state of consciousness. Some of these techniques include Tai Chi and yoga. Other meditation techniques include being motionless, chanting, or focusing on a single object or point. During meditation, several brain regions are activated and parasympathetic responses increase to allow for deep relaxation. Some of the benefits of meditation has shown to be reduction in pain, anxiety, and stress, lowering of blood pressure, improved cognitive functioning, and improved mental health. Just 30 minutes of meditation has been shown to give relief from anxiety and depression just as much as antidepressants. The last altered state of consciousness in chapter 5 is hypnosis, which is a heightened state of suggestibility, deep relaxation, and intense focus. It is also characterized by narrowed, highly focused attention and have an ability to tune out the environment around you. Increased use of imagination, a more passive and receptive attitude, decreased responsiveness to pain, and heightened suggestibility or a greater willingness to respond to proposed changes in perception or be obedient. You can see here some of the common hypnosis myths. While hypnosis can be used in comedy routines, which I highly recommend to go see, they are hilarious. Physicians and therapists often use hypnosis even in surgery and for the treatment of cancer, chronic pain, and severe burns. One myth states people under hypnosis can recall things that otherwise could not. While true, memory recall does improve, but the number of errors in memory also increases. And that is what was not covered in class for chapter 5. Hopefully you find this helpful. Moving on to lifespan growth and development. We have a couple things to cover, but for the most part, covered all of Chapter 4, Chapter 5, and Chapter 6 this past week. First is development of hearing in Chapter 4. Remember we were talking about the senses? All the senses are pretty well developed besides vision at birth. Infants will often turn their heads wherever they hear sound coming from, and by the time they reach 18 months, their accuracy in determining where a sound is coming from increases, and their hearing is very similar to an adult. As infants get older, their senses of hearing, or their ability to detect different pitches of sound, increases as well. By 3.5 months, they are fully able to discriminate sounds of their parents' voices. They are able to discriminate sounds in the primary language spoken to them and acquire language. However, as they learn the sounds of their native language, they gradually lose the ability to discriminate sounds of a different language. This is the reason it is difficult to learn a new language later in life. Our brains are already used to the sounds of our native language, and we have to retrain the brain to discriminate new sounds. Parents also report that their infants are waking up easily at night to the slightest sounds. This is true when parents are overprotective in attempting to keep the infant's room as quiet as possible. However, the brain learns through classical conditioning the sounds they experience when they sleep. If an infant has a slight backdrop of noise in their room as they fall asleep, the noise levels become habituated to them, and the infants are not likely to awaken to noises unless the sound is very sudden and sharp. Infants also develop the ability to recognize that objects experienced by one sense are the same thing as those experienced by another, such as their bottle. They can feel the bottle with their hands, place it in their visual field, and realize they are seeing is also the same thing that they are touching. This has been shown in infants as young as 1 month old. In all of my classes, we finished Chapter 5. So I'm going to cover the last couple of slides we didn't have time for in Chapter 6. The development of an infant's self-concept, the realization of recognizing themselves, self-awareness. In primary circular reactions, the second substage of the sensory motor stage of cognitive development, a child learns that the idea of moving and putting their hands in front of them and being able to manipulate their environment by moving. But they don't necessarily realize that when they place their hands in front of their visual field, it's their hands. Around the middle of the second year after birth, infants begin to develop self-awareness. They also eventually develop a self-concept that the hands directly in their visual field are theirs. At some point, they begin to realize that their own bodies extend only so far. The mirror technique is used to be able to determine when the self-concept is developed. A dot is placed on the child's nose or somewhere on the face, and a mirror is placed in front of them. Before 18 months, an infant will look at the mirror and may even see the dot, but doesn't respond to the dot or their own reflection. However, at around 18 months, an infant will notice the dot, and instead of reaching out to the mirror, they will touch and try to remove the dot from their own nose or face. Touching the dot and trying to remove the dot shows that an infant is able to recognize themselves and sees the dot as something that isn't supposed to be there. Each child is born with a characteristic called temperament, which is a stable way of reacting and adapting to their environments. They are exposed to after birth, and it's consistent throughout life. There are 3 main types: easy, slow to warm up, and difficult. A child who has an easy temperament typically has regular sleep and feeding schedules, shows enthusiasm and excitement to new experiences such as new schools, and is very cheerful. As they get older, they are more easy to get along with and approachable. The difficult temperament typically has irregular sleep and feeding schedules, slow to accept new people in their lives, do not like change, takes a long time to adapt to new environments and adjust to new routines. They often respond to change with frustration, and when they do not get their way, throw tantrums and begin to cry. The slow to warm up temperament falls between the two. They may appear difficult at first, but eventually begin to accept change and new people into their lives. This kind of temperament is associated with infants who are less grumpy, quieter and more regular than difficult children, but who are slow to adapt to change. If change is introduced gradually, these babies will warm up to new people and new situations. Temperament is typically consistent throughout infancy, childhood, and all through adulthood. While we may not throw tantrums in adulthood, well, for the most part, a difficult person would still show adult signs of not adapting to a new environment or are uneasy to letting new people into their lives. People with a difficult temperament have a greater risk in developing psychological disorders as well. And that's it. That is what you missed in week 4 of the fall 2018 semester. If this helped, please hit the like button and I will see you in class or in the next video. Thanks for watching. Ciao.